listening to Alabama the Beautiful with cosmetic surgeon Dr. James Koehler and Kirsten Jarvis.
Hey, Dr. Koehler.
Hey, Kirsten.
What do you want to talk about today?
You know I always let you pick, so what you got?
All right. Well, our wonderful surgery coordinator had an idea about people traveling to Fairhope and why you would come here for cosmetic surgery.
I mean, why wouldn't you?
Exactly. Why wouldn't you?
Yeah, this is like the land of unicorns and rainbows, so I think you should come here.
Yes. Piers and sunsets. That's what we're known for in Fairhope.
Piers and sunsets. Yes.
Piers and sunsets.
All right.
Okay. All right. Well, let's talk about you first.
Okay.
When did you move from Tulsa to Fairhope?
It's been 11 years now, I think, something like that.
Oh, my. Okay. Is it true that you still have old patients coming here to see you in Alabama?
Yeah. Actually, when you're in a place for a long time, which I was in Tulsa, I had some people that I've already operated on, and sometimes even new people that, they wanted to come see me. And even though I was, 12 hours away or 10 hours, that's a 12-hour drive, people were making the trip. So, yeah, it's an honor. And, it's nice to see these people that make the trip to come see me.
Yeah, we love that.
Yeah.
I think we just had a couple last week or the week before that came. I don't think they were previous patients. I think they were referrals. Is that right?
They weren't previous patients, but they were referred to me by a previous patient. And so, husband
cool.
and wife came to visit me. So that was pretty cool.
Yeah, I like that. Okay, so what are some reasons that people may travel for surgery instead of staying close to home?
Yeah. Well, of course, they're coming to see me, Kirsten. That's why.
Exactly.
No. I think obviously the obvious reason why people travel outside of their home city is that, like, for instance, in my case, I have previous patients that trusted me with prior surgery. And, when you develop that relationship with your doctor that you trust, it's sometimes hard to go to somebody else. And they can be very good. It's just that you feel confident in that person. And making the step to have surgery is a big decision. And so the biggest hurdle is, first of all, feeling confident with your doctor. So for me, that's one of the reasons that I have people that travel, is because they're prior patients and they feel comfortable with me. And then, of course, there's just the general referral system that, like, we have people here in Fairhope that have family members outside of the state. And so whether that's sons or daughters or, mothers, whatever, and they want to have a procedure and their family members like, I want to take care of you here. And there's a good doctor that I really think you'd like. And so we have a lot of that as well. So that, those are some of the reasons. And then sometimes you get known for certain procedures that, people are like, oh, hey, I hear he does really good with X, Y, or Z. I like his facelift, so I'm going to come see him for a facelift. And so, those are some of the reasons people will make the trip.
We have a patient that she originally was from Fairhope, moved to Atlanta. She got a nursing job there and wanted to come back to you. And so you did her surgery, and we schedule her post-ops around her schedule when she's going to come back to town to visit. And then now she's become a med spa patient. So whenever she's in Fairhope, she shows up at the med spa. We love it. Yeah. It's a long way to travel for that kind of stuff, but we really appreciate the loyalty, really.
Yeah, for sure.
Also, coming here, I think people can kind of be discreet. Like, if they don't want to be at home and recovering in their hometown and have to be seen at the grocery store, they can kind of come here and chill. And this is a very nice town to kind of take a break and recover discreetly. Yeah,
I mean, certainly there's the privacy issues. Even if you walk right through the front door, if you're from out of the state, I mean, nobody knows who you are. Yeah. But I think a lot of the stigma of that might have been a thing years ago. I still think obviously people want their privacy, but I don't think the stigma of that is nearly what it used to be. So.
Do you offer virtual consultations for people that are coming from out of town?
I mean, I think, our patient care coordinators will do a lot of the work virtually, but like when it really kind of comes down to it and they're like, yeah, no, I'm ready to have surgery, we really want to have a one-on-one. Like, I don't want to be seeing this person for the first time face to face, morning of surgery. I mean, you can look at pictures and you can talk to somebody, But when you see somebody face to face, sometimes there's little things that you pick up on. You're like, oh, hey, this could be an issue. And you just don't want to have that showing up at the day of surgery. So, yeah, when we're really ready to go forward, we like to have a face to face. But we can do a lot of the work ahead of time, very, very much so virtually.
For patients that need medical clearances or labs, do you require that they get those done locally, or can they be from out of town and do that in their hometown?
Oh, yeah, they can get that all done anywhere, as long as, especially for clearances, a lot of times, I mean, they have a doctor and, we want it from their doctor. We don't want it from somebody that's never met them before. So, yeah, so they can get their labs done wherever. And, most of the time, obviously, this is elective surgery, so most of the patients we're treating are healthy people. They might have some mild things, but there are some circumstances, and obviously we do have, I have privileges at the local hospital here, so if somebody is in a little worse health, yeah, we might do it at the hospital.
Is there a time frame, or like how far out in advance should patients be booking surgery if they don't live locally?
Well, really need to be looking months in advance. First of all, we're booked out for a while, so it's not like you can just say, I'd like to go next week. I mean, you really need to plan this, but when you're planning surgery, especially surgery where you're going to be out of state, there's a lot of things to prepare for. Like, we talked about getting the labs ahead of time, and then just taking care of your life. Maybe if you have pets, making sure those are taken care of. Who's going to take care of you? Where are you going to stay? All these things that you kind of got to plan for. I think it's also good to just make sure you have a contingency plan too. So, like, let's say we go, oh well, we want you to stay here a week before you go home. But what if we had to keep you for a few more days? Like, do you have the ability to do that? Even if you're having surgery at home, I mean, those things can happen. Like if we said, oh, you should be able to go back to work in a week, but what happens if it turns to 2 weeks?
So you mentioned staying in town for a week post-op. Is that your general recommendation? You want people to stay around for about a week?
For a lot of things, yes. But sometimes, like if it's a bigger procedure, we might want to stay 10 to 14 days, a little bit longer. It depends on whether or not they're going to have drains. It can depend on a lot of things. So I don't want to just say a blanket statement, hey, a week. For minor stuff, like you could probably go in a couple of days, and if it's, something that doesn't have sutures that require removal and things like that. But if we have stitches that we need to take out, that's typically going to be at a week. Drains are usually at a week. It's somewhere between 1 and 2 weeks typically that we'd like you to stay.
We call in our patients antibiotics and medications and stuff ahead of time. So other than medications for out-of-town patients, what sorts of things do they need to bring with them if they're traveling for surgery?
We're going to give you a list of sort of items that we recommend post-surgically, like whether it's antibiotic ointment or gauze or whatever. We're going to give you that list. Probably easiest just, to come the day before, go to the pharmacy and get your things like your, chlorhexidine soap that you're going to wash with beforehand. I mean, you can bring those things in your travel bag, but a lot of times just easier to get it when you're here. But we're going to give you that list. Other than that, I mean, have a good book to read, get your Netflix ready. I mean, you want to just have some things to do while you're chilling.
Yes. It is a small town, but we do have a Target and a Walmart and a Walgreens.
It's not that small.
No, not anymore. Why is it not safe to travel too soon after surgery?
Well, I mean, I think the biggest reasons for not wanting to travel too soon would be maybe risk of a hematoma. Most of the time, hematomas, whether it be with a facelift or a breast aug or anything, most of these hematomas are going to happen within the first 24 to 48 hours. So if you were to leave the next day, I mean, a lot of times for simple things like a breast augmentation, you're probably fine. I mean, if you didn't get a hematoma overnight, you're probably going to be fine. But if you overdo it, you strain, you travel, all of a sudden now you get a hematoma. And this is not like an emergency from the standpoint of like life-threatening. These things are usually self-limited. So like, let's say it's with a breast augmentation, you got a hematoma. Well, your breast would swell, it would get very uncomfortable, and it would swell up quite a bit. The pressure would build up and it would stop bleeding, okay? But you'd have one breast that's significantly larger than the other and be very uncomfortable, and it typically requires surgery to go back, evacuate all that blood that's in there, and figure out what started bleeding. So you want to be nearby for those first few days to make sure if something like that was to happen that you could get medical care that you needed. So that'd be one reason. The other reason, I guess, issue for travel is If you have drains, like I said, we typically like to take those out ourselves. But then the risk of blood clots. So, there's a risk of getting a blood clot in your legs, even if you haven't had surgery. For long periods of time, if you're immobile, I mean, like sitting in a car, sitting on a plane, that puts you at risk for a blood clot. And surgery is another thing that puts you at risk for a blood clot. So when you go to sleep for surgery, the muscles in your legs, and they're not moving the blood typically like it would when even if you're sleeping, you've got tone to your muscles and you're moving a little bit and it's moving the blood. When you're under anesthesia, we put compression stockings on, we put compression pumps on. In certain surgeries, we give you a shot of blood thinner to prevent blood clots. Even if you left a week or 2 weeks afterwards, those risks still apply. Okay, so it doesn't mean you're out of the woods after a week, because really the risk for blood clots is for several weeks after the surgery. So we're going to, if you're at a higher risk, we're going to put you on some medications to help thin your blood. But if you're driving, we kind of recommend, get up, walk around, every few hours, like stop at a gas station. You don't have to do much. Walk around a little bit, get back in the car. If you're flying, most of the flights here within the U.S. are kind of shorter flights, unless you're traveling, like, let's say, all the way coast to coast type of a thing. So you should be fine, but you can get up, stand up, go to the bathroom once during the flight. Probably be fine to get up and just move a little bit.
Can patients come alone, or do they need to bring support or a travel buddy?
Yeah, no, absolutely don't come by yourself. Unless you've got to have somebody with you. I mean, we won't discharge you from our facility by yourself. Like, I can't throw you in an Uber and go, hey, good luck. So you need to have somebody responsible that can take care of you. And you might only need that closer care for the first 24 hours, just to make sure, if you need some assistance getting up, if you feel a little lightheaded after anesthesia, make sure that you get your medications when you're supposed to get them. And because you might not be, the effects of anesthesia, you might lose track of time and not be totally cognizant. So, but usually after the next day, people are fine. They may not need that, close care, but there's somebody there. If you need to get something from the store, somebody can go run an errand for you, so you do need to have somebody.
What have we asked our team to do to help make things easier for people that travel from out of town?
Well, I mean, I think the things we've done is, we mentioned a little bit already, is that we have all the post-op instructions. So we go through that ahead of time, make sure they have all the supplies, that they can get themselves prepared for all the supplies. And then we can kind of help give people guidance of where places to stay in and around Fairhope. And there's a lot of great places to stay here. They've got access to our patient care coordinators. They are really responsive. So, they can talk to them prior to getting here. Then once they've had the surgery, patients have multiple ways to communicate with us, through texting, through calling. So those are the things we kind of do to help people get prepared.
Let's talk about what airports to use when people fly in here.
Yeah, state of Alabama's not going to like this, but I fly out of Pensacola. It's that airport is, in my experience, been much more convenient in terms of, I haven't had as many issues with canceled or delayed flights. Security has been generally a pretty good experience for me compared to flying out of Mobile. But I mean, it's a little bit longer, but actual travel time ends up typically being less. It's a straight shot on I-10. So go from Pensacola and you're here in an hour. It's an hour drive from the airport to here.
In Mobile, you've kind of got to fight traffic a little bit to get over here, so it takes a little bit longer. But Pensacola is like you said, just straight interstate.
Yeah, the distance is shorter to the Mobile airport, but I've had plenty of times where it's taken me well over an hour to get across the bay. So, yeah, I mean, that's where I would recommend flying in and out of, is Pensacola.
Okay. Do we have any specific hotels around here that you prefer patients stay at, or do we have partners or anything?
Let me ask you that. I mean, where are you guys recommending? I know kind of my favorites, but what are you recommending to
Well,
patients?
yeah, of course we want everybody. If you are coming here, a very nice, luxurious place to stay is the Grand Hotel in Point Clear. It's 10 or 15 minutes down the road. But then we also have some smaller hotels. There's a Hampton Inn in downtown Fairhope, and downtown Fairhope is charming and beautiful. So if you're coming for surgery and you want to come a couple days early, I would definitely recommend staying at the Hampton Inn in downtown Fairhope. Or there's a couple more like budget-friendly hotels closer to the interstate as well.
Yeah, I think there's plenty of locations. Definitely, the Grand Hotel is kind of, It's beautiful. That's where all the weddings and everything, all the big functions are going to be at the Grand. It's right on the bay. It's pretty. And I definitely like, downtown. Downtown's nice because, you can go walking around and lots of nice stores and places to eat. So I think that's a really convenient place too.
There's cottages and Airbnbs and stuff downtown on the bay. So if you'd rather have a home to stay in, there's lots of Airbnbs and places like that right on the water. So
yeah,
makes it nice. Okay. Well, how difficult is it to get around Fairhope? If somebody flies in here, do they need to rent a car? Do we have Ubers? How's that work?
Well, I think there's Ubers, but I don't know that you're going to get the kind of Uber service that you get in some of the big cities. I'd say, you probably are going to want to rent a car. I mean, you could get an Uber from the airport probably to Fairhope. I would probably rent a car. But once you're here, like if you're in downtown Fairhope, it's very easy to get around in Fairhope with or without a car. And really, like I said, if you stay in downtown Fairhope, I don't really know that you need a car except for to get to and from the airport because everything you need is kind of right around there. There's a pharmacy and there's stuff close by that, you can get an Uber. It's just you might not have it like pronto like you would in some bigger cities.
Right. Also, downtown Fairhope, they've started a free shuttle service. So there's like a limousine golf cart that drives you around, takes you from end to end in restaurants and
a limousine golf cart.
It's just like a long golf cart that can fit people on it, but it's free. It's like retired people drive people around.
Well, I like the idea. No, it's great. Yeah. I just never heard of a limousine golf cart. I mean, I might want one for the next time I go golfing.
Oh, there you go. Okay, that's just the city of Fairhope trying to throw something nice in there for. Can we get DoorDash and Uber Eats and things like that here?
Yes.
Yeah, Fairhope has amazing restaurants. Are there some mistakes to avoid when traveling for cosmetic surgery, like booking your return flights too soon? Should they have their return flight to go home when they plan this, or should they wait to book that until they're fully ready to go?
No, I think it's great to go ahead and book the return flight, but you want to maybe pay that extra money so that if you have to do change your flight, that you're not getting charged or not able to change your flight. So I think that's just an important thing. I mean, it costs you a little more to do that with the airlines, but you want to be able to change your return flight if you had to. But I think preparing for, once we've had a discussion and we feel pretty good about how long we'd like you to stay and we tell you that and say, okay, yeah, I think you could fly back in a week or 8 days. Yeah, go ahead and make your travel plans, but just make sure you have that contingency plan in place.
What about not staying close enough to the practice? Like, would you prefer people don't go stay in Mobile?
I mean, I think if you're traveling out of state to have the procedure done, it's kind of nice to be closer because we're going to need to see, we always see everybody, for these out of state people, like we're going to be seeing you post-operatively before you go. So, I mean, you don't have to be right nearby. I mean, if you're in Mobile, that's fine. We have lots of people that come from Mobile every day for surgery. So it's really up to you. But I think if you're traveling from out of state, being within the Fairhope area is good. The likelihood of needing to go back to surgery is rare, but if it did, I mean, you'd want to be reasonably close by.
Mm-hmm. And Fairhope's a destination. Like, it's fun to just come stay and enjoy the bay and the shopping and everything anyways. So, but we don't want people to go out the day after their surgery and enjoy the downtown. If you want to come, this is not a vacation. If you want to come enjoy the town, come a couple days ahead of time.
Yeah, you can't come binge drink before the surgery and go out for martinis the day after surgery. Like, those are like in your booklet. You got to stay away from alcohol. And
yes, and we don't want you to walk clear around town after you've just had surgery. Do you have any other things to talk about to avoid?
Not to avoid. No, I mean, the things to avoid are going to be in that preoperative booklet, like medications. We'll go through all that. Medications we want you to avoid, but, things like alcohol. And obviously for surgery, nicotine is a big thing. We talk about it at, consult and pre-op. But, there are things that you do need to potentially avoid, and we'll go over that.
Okay. Do you have a burning question for Dr. Koehler or me? You can leave us a voicemail on our podcast website at alabamathebeautifulpodcast.com. We'd love to hear from you. Thanks, Dr. Koehler.
Thanks, Kirsten.
Go back to making Alabama beautiful.
I'm on it.
Got a question for Dr. Koehler? Leave us a voicemail at alabamathebeautifulpodcast.com. Dr. James Koehler is a cosmetic surgeon practicing in Fairhope, Alabama. To learn more about Dr. Koehler and Eastern Shore Cosmetic Surgery, go to easternshorecosmeticsurgery.com. The commentary in this podcast represents opinion and does not present medical advice, but general information that does not necessarily relate to the specific conditions of any individual patient. If you enjoyed this episode, please share it and subscribe to Alabama the Beautiful on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts. Follow us on Instagram at Eastern Shore Cosmetic Surgery. Alabama the Beautiful is a production of The Axis, TheAxis.io.